Hi guys, welcome to my channel. I'm your pharmacist Sidra, and today I've made this short and sweet video to talk to you about the new shingles vaccine called Shingrix. In this video, I'm going to compare the Shingrix to the older vaccine called Zostavax, which is a live vaccine and it has been available in the market for quite some time. So let's start by talking a little bit about shingles so you can know why it's important to get vaccinated against this dreadful disease. Shingles is a very painful rash that usually develops on one side of the body. The rash consists of fluid-filled blisters that typically scab over 7 to 10 days, and sometimes it may take about 2 to 4 weeks to completely get rid of these rashes. Now, shingles is a very painful disease. Some people describe it as a burning or shooting nerve pain, and this pain may last even after the rash has been resolved for a couple of months and even for up to years after the rash has been resolved. The nerve pain caused by shingles is one of the very common complications caused by the shingles. Now, sometimes shingles may affect eyes as well. People may get rash inside the eyes or outside the eyes, which may result in change in vision or even in worst cases may result in blindness. Rarely, individuals with shingles may develop inflammation in the brain. This condition can be life-threatening if severe, especially in people with impaired immune system. Now, as they say, prevention is better than cure. Therefore, it's very important to get vaccinated against shingles. At the moment, 2 vaccines are licensed in the United States and recommended by ACIP to prevent shingles. The first one is the Zostavax, which is a live vaccine and has been available since 2006. Now, there is another new vaccine which is called Shingrix and was made available in the market in 2017. This vaccine is not a live vaccine and is recommended as a preferred vaccine by ACIP. I want to first talk a little bit about Zostavax, just so you understand how the new shingles vaccine is better and more effective in the prevention of the shingles. Like I mentioned before, Zostavax is a live attenuated vaccine. It is recommended in healthy individuals 60 years and older. This vaccine is given as once in a lifetime dose. It should not be given in pregnancy, in immunocompromised patients, or people who have allergy to gentamicin or neomycin. The live Zostavax vaccine can still be used to prevent shingles in healthy adults 60 years and over. Also, we can still use Zostavax in patients who are actually allergic to Shingrix or request immediate vaccination or when Shingrix is not available. Alright, now let's talk about Shingrix vaccine. This vaccine is recommended for healthy adults over 50 years. It's a non-live adjuvant vaccine. Now, the fancy word adjuvant over here means that this vaccine contains a substance that is added to the vaccine to increase body's immune response to the vaccine. Now, this is in particularly beneficial for elderly people who have weakened immune system, and this new Shingrix vaccine is actually considered to be 80 to 90% effective in the prevention of the shingles. This vaccine is also recommended in adults who have previously received the Zostavax live vaccine and is considered to be better and more efficacious compared to the Zostavax. Now, Shingrix is a 2-dose series. The first dose is given at the age of 50 or older, and the second dose is given within 2 to 6 months of the first dose. Now, people often ask me what to do if they've passed the 2 to 6 months windows to get the second dose of the vaccine. Well, that's alright, as the vaccine series do not need to be restarted if more than 6 months have been passed since the first dose. However, if dose 2 is given less than 4 weeks after dose 1, then the second dose must be repeated. In a nutshell, 2 doses of Shingrix vaccine are necessary regardless of the prior history of shingles or the previous administration of the Zostavax live vaccine. I've noticed a lot of people resist from getting the vaccine because they're afraid of the side effects of the vaccine. So let's just talk about the side effects and adverse reactions from the vaccine. The most common adverse reaction from the vaccine is the local or injection site reaction. Now, the local reaction could be redness, pain, or swelling at the site of injection, and the majority of which goes away on its own within 2 to 3 days. You may also experience generalized reaction like muscle pain, fatigue, or fever. These are more of the minor reaction and most commonly occur within few hours of the vaccine administration, and they resolve on their own after a short period of time. For example, a lot of people complain about sore muscle, and to resolve that, I often tell them to move their arm in circular motion like this, right? Like slowly move your arm in circular motion, and that should help resolve the muscle soreness pretty quickly. Also, you can use ice packs on the sore muscle every 20 minutes within the first 24 hours after the vaccine. Another common adverse reaction is fever, chills, or shivering after the vaccine. This may last for up to 2 days. So if that occurs, just take Tylenol or ibuprofen over the counter. It's important to note here that the over-the-counter analgesic should only be used to overcome the symptoms of fever, chills, or shivering, but it should not be used to prevent these symptoms, as taking these analgesics is not going to prevent the fever or chills from occurring. I encourage the patients to get the second dose of the shingles vaccine even if these minor symptoms occur, as the benefit that you're going to get from this vaccine is far better than these minor side effects. Now let's talk about some major side effects which should not be overlooked, and if they occur, then you should not get the shingles vaccine again. The first and the most important is that after administration of the vaccine, if you get a severe allergic reaction like difficulty breathing, swollen lips or tongue, and you have to rush to the ER, then you're potentially allergic to one of the ingredients in the vaccine and should never get it again. Alright guys, that's it for today's video. I hope now you know the importance of getting shingles vaccine. If you have any questions, please ask in the comment sections below, and subscribe to my channel Ask Your Pharmacist so you never miss any amazing videos about health and pharmacy.